This section will discuss strategies for maintaining financial wellness. Our speaker today is Claire Tobin. Claire is the manager of social work services with Rush University Medical Center's Supportive Oncology Department. She leads a team of social workers and navigators who provide clinical interventions and care management support for patients and families engaged in care at Rush's outpatient center Cancer Center. She earned her master's in social work from University of Chicago's Crown Family School. Please welcome Claire.
Thank you. Welcome, everyone. In my current work, my team and I support patients and caregivers engaged in care at Rush's Cancer Center, and we assist with any non-medical needs that come up as they go through their treatment. And a very common need and concern that they name is finances, figuring out how to manage ongoing household expenses while also navigating extensive medical bills or anticipated medical bills. And I appreciate you all coming to join me today. I want to acknowledge just even the topic of money itself can be very anxiety-inducing, but my hope in today's session is to give you some different strategies and concrete resources that can help make it more feasible to manage expenses. And ideally give you some power and control over your finances as you go forward with treatment. I have no disclosures or conflicts to report. Objectives for today's session are to define financial toxicity, talk about strategies for navigating health insurance and medical bills, as well as strategies for managing treatment-related expenses, and to identify some concrete resources that can help with treatment-related finances, both within the medical system and within the community. So our agenda for today will cover each of those items and want to start by just taking a moment to talk about this concept of financial toxicity. This is a term that's used to describe the harmful effect that cost of treatment can have on quality of life and well-being. It was first coined in 2013 in an oncology journal and was specifically talked about in relation to the extensive cost of cancer treatment. But I found this term is really quite applicable to folks navigating any kind of major medical condition. So to quote, out-of-pocket expenses might have such an impact as to warrant a new term, financial toxicity. Out-of-pocket expenses related to treatment are akin to physical toxicity, and that costs can diminish quality of life and impede delivery of the highest quality care. Existing data have identified both objective financial burden and subjective financial distress as key components of financial toxicity. So basically, this idea is that financial toxicity is referring both to financial expenses themselves and the burden they can have on your household, and also the emotional toll of these expenses or anticipated expenses. My hope in today's session is to help prevent financial toxicity and give you ideas to help before things become an emergency situation, so that you're able to be in a place where it feels financially feasible to pursue the treatment you are being recommended or wish to pursue. There are a number of different factors, as I'm sure you well know, that can contribute to financial stress during treatment. Certainly the type of tumor you have, the type of treatment you're being recommended, whether you or family members will need to take time off from work, how much time you may need to take off from work and how that may impact your income, as well as things like household size, insurance coverage, are all going to be factors in impacting the amount of financial distress you may have. So as we move forward, we're going to be focusing on some of the specific topics that tend to be the biggest causes and sources of financial stress. And hopefully, again, arm you with some tools and strategies that make these feel more manageable. So I want to start with another very fun topic, health insurance and medical bills. These tend to be major factors in financial frustration. So I have some strategies and tips. Some of these may be things you already know and are doing. Hopefully I'll also be presenting some ideas that are new and helpful to you moving forward. So briefly, just to give some basic guiding principles of where to start with bills and insurance. The first piece is simply staying informed. The more you know and understand about your insurance coverage, about anticipated medical bills, the more proactive you're able to be in identifying potential gaps and challenges before they become a crisis. So that includes understanding your insurance coverage benefits. We're going to get into some of the specifics of that in a few moments here. Communicating with your medical team about expected costs of care. Additionally, getting organized. This can include both creating a budget, if this is something you're not already doing, or if you already have a budget, adjusting it to incorporate anticipated potential medical expenses, which can often be a huge added expense and major burden, and can be really scary to honestly to factor into your budget. But again, the more you can do at the front end to anticipate what might get tight and tricky, the more options you're going to have to help you along the way. And try to get ahead of problems before they become an emergency. Additionally, part of getting organized also includes developing systems and routines to help you keep track of paperwork and medical expenses. This includes, some folks like to keep a binder where they keep copies of all the different insurance communication that's coming in, the bills that are coming in, sort out into sections what is purely informational and FYI they should save for the future, what are bills they need to follow up to ask clarifying questions about, what are bills they need to pay, and getting organized as you can so that you feel in control of your finances rather than feeling like they're controlling you. This is also very much something we encourage folks to enlist the help of their support system in dealing with. Managing paperwork, insurance, billing issues can feel like a full-time job. And a full-time job you certainly don't have time for when you're also managing a major medical condition. So we really encourage folks to enlist the help of friends and family members to help you open paperwork, sort paperwork, follow up with insurance companies and billing companies. So we'll talk a little bit more as we go on here about ways to help us stay informed and organized. Along the lines of budget, just quickly wanted to highlight, in case you're not already budgeting or don't know where to start, there are a number of great free tools that can help you. Most every software program, including Microsoft and Apple, has free budgeting templates. I included a couple I grabbed from Microsoft that were free on the right here. And then there are also some phone applications like Mint and NerdWallet that have free budgeting tools. So would certainly encourage you, if you're not already using something, to look into one of these free resources to help you kind of keep track of what money is coming in and what money is going out. So again, you can try to predict and anticipate potential challenges. With that, I want to talk a bit more about when we talk about staying informed with health insurance, what all is involved in that. So first, know your insurance plan. Health insurance policies are rarely fun reading, but taking time to read through, or again, have friends or family members help you read through to understand the ins and outs of your policy can be incredibly helpful in knowing what's covered and to what extent. That includes not only medical expenses, but also many insurance plans offer other benefits that can be incredibly helpful during treatment and can potentially help you save money. Many plans offer a reimbursement for travel and lodging related to medical care. So some plans offer hotel reimbursement, gas reimbursement. Some plans offer free rides to medical treatment. Some also offer things like exercise benefits, free meals after hospitalizations. These are things that may not be advertised to you in your plan, but by looking through your policy or talking to your member services line, they can help advise on some of those hidden benefits that might actually be really helpful for you, so you can kind of make your insurance work for you. Additionally, there's a lot of jargon involved with health insurance, things like copays, co-insurance, deductibles, out-of-pocket maximum. All of these, it's kind of different, what might be involved in each insurance plan, but it's not uncommon to see words like this that will indicate what to expect as far as some of your out-of-pocket responsibilities. Having a sense of what's involved in your plan's out-of-pocket responsibilities, as well as in-network and out-of-network benefits, prescription coverage, is again going to be helpful in kind of giving you a heads up so you can navigate your care and be making sure, to the extent possible, you're able to get as much that you need covered. Similarly, brain tumors typically involve a lot of engagement with specialists. Sometimes to see a specialist and get it covered by your insurance, referrals are required from a primary care doctor. Sometimes there are prior authorizations your insurance plan may require to get certain services covered. Knowing some of that ahead of time, again, will help make sure you're able to proactively follow all that's involved in your plan, so that you're increasing the odds of getting the care you need covered the first time without needing to fight with insurance. And then additionally, this might seem simple, but do want to remind you to please make sure all healthcare providers have your updated insurance information on file. That includes any medical providers you're seeing, but also things like any pharmacies you're getting medications from. It's not uncommon sometimes for you to get a bill for something that's simply a mistake because the place you were getting care didn't have your updated insurance and may have forgotten or overlooked billing your insurance directly. So always good to make sure anywhere you're getting care has your current information on file. Additionally, along the lines of staying organized and staying informed, it's important to keep records of everything. I know I mentioned the idea of a binder system earlier. Some folks also like to use electronic systems or keep track of everything on their computer, but it is important to be saving everything you're getting and taking time to review it. One example of something you are likely to get from an insurance company is an explanation of benefits, or EOB. I included a copy of what that looks like. I see some nods in the room. It seems like some of you are familiar with these, whether you want to be or not. These can be incredibly intimidating to look at. They often have some big, scary numbers on them. Typically, anytime you get a medical service and a claim is sent to your insurance, you will get an explanation of benefits explaining both how much the service cost, how much the insurance company will be covering, and what your likely out-of-pocket expenses will be. This is not a bill, and you're not expected to do anything immediately upon receiving this. But I would encourage you to review it to make sure it looks right to you and matches your understanding of what you thought your insurance was supposed to be covering. It is possible for errors to get made sometimes by billing companies, by insurance companies. These errors often can be rectified. Sometimes things get coded wrong, or there's a typo in whatever gets entered in the system and billed to insurance. But these services or these mistakes won't go away on their own. You do need to speak up and let someone know. So it is important to be reviewing these documents to make sure they generally look right to you. And then also to be saving them so that when you get the corresponding bill, you can also double check to make sure they roughly match up. Another thing that's really valuable about explanation of benefits is they typically will include towards the bottom where you're at and the progress you're making towards planned deductibles or out-of-pocket maximums. Many plans have an out-of-pocket maximum that's going to be the top amount you're expected to pay in that calendar year. If you reach a point at which you've paid that, for most plans, that does mean 100% of medical care after that point for the rest of the year, they should be covering, and you're no longer responsible for. That said, sometimes it takes time for billing companies to catch up with insurance. Knowing where you're at and how close you are to your out-of-pocket maximum will make sure you're not paying for more than you need to be paying for. So this is just a helpful check of your understanding of your insurance plan. And then, as I mentioned before, if something doesn't look right or just seems confusing or unclear, reach out. Call your insurance company or ask a friend or family member to take time to wait on hold for you and try to ask some clarifying questions to make sure you understand and advocate if something seems like an error or seems like it needs to be corrected. As we talk about keeping records of everything, can also be incredibly helpful to keep track of any calls you are making and conversations you're having with insurance. I included a few examples of tracking tools that may be helpful. On the left, these come from Cancer and Careers, which I would recommend for folks with any medical condition beyond just cancer. They have a lot of resources related to navigating work-related concerns. And so they have some logs just for keeping track of calls you're making to insurance providers and of any insurance claims you're dealing with. I also, on the right, just included a really simple spreadsheet you could make on your own. The most important things to be keeping track of really are when you called, who you talked to, what you talked about, and any next steps. You also have the right to ask. Many insurance companies or billing agencies will be willing to email you a written summary of what was discussed, so you can get something in writing if helpful to add to your binder. Another common concern with insurance is the possibility that despite all your best efforts to be proactive, understand your plan, try to make sure things are getting covered, it is possible at some point you may get a service denied. This is not uncommon, but I do want to encourage you, it is worth your time and energy to try to find out what's going on and see if it's possible to overturn or appeal the denial. In many cases, when you do take the time to do this, as I mentioned before, sometimes errors do happen and it's actually quite a quick fix. Sometimes the insurance may be tough on something and really try to resist covering a service that your doctor's recommended for you, but about 60% of appeals that folks take the time to do actually get decided in favor of the patient, meaning the service does ultimately get covered. So a few things to think about if you do get a denial or get notified by your medical provider that's something they were requesting for you, your insurance is pushing back on. Call your insurance company, try to clarify what happened, and explore any options for getting the denied service covered. Sometimes it may be as simple as they need to refile the claim and get a letter or additional information from your doctor justifying the need for the care. If that's not enough, find out the steps of the appeal process. All insurance plans have some kind of process. It's typically a written appeal, and typically they give you a certain amount of time, like 30 or 45 days, to initiate the appeal and submit the requested documents. Since getting a denied service covered often involves additional medical documentation, and typically insurance plans will be looking for basically medical necessity is the terminology they use. It will be really important to let your doctors know, if they don't already, that this is being denied, since typically additional documentation from them will be very helpful in trying to fight for an appeal. And in most cases, if your doctors have recommended this service, they will be very willing to do whatever is needed to get additional documentation and help advocate for your needs with the insurance company. There are also sometimes advocates through HR benefits companies, some state departments of insurance who can also assist in appeals process. So do feel free to ask for help from other sources if you are facing a battle with insurance for something you need covered. With that, I want to talk a little bit about something that's tied pretty closely with insurance, which is navigating medical bills. Similar to insurance communication, this is another piece of paperwork you probably wish you could pretend wasn't there. It's easy to want to let these pile up. Another potentially helpful system or routine with insurance paperwork and bills is to pick, for instance, one day a week where you and a friend or family member sit down and open everything that came through at one time and sort and organize it. It can make it a little less overwhelming to do as a regular ritual and to do with someone else. But just like insurance communication, billing statements, well, they can be scary. It's important to know what they say if anything's confusing or doesn't seem right and needs to be followed up on. You actually have a number of options and a lot of power in how you navigate bills, including potential options to get help with them, but only early on. If you wait too long and they become past due, you're going to have less and less options, and the billing companies are going to be less likely to work with you to figure out a solution. So I'd encourage you to open all bills as you're getting them or on a regular basis. Review them to make sure they look right. Check them against those explanation of benefits. Make sure they match your understanding of what this bill was supposed to be. If something doesn't look quite right, or it's an unexpected bill that didn't even come up in an explanation of benefits, call the billing agency. Check that your correct insurance plan is on file. You can check that the correct service or code was billed. If you're getting a bill for a number of services at once, you can also ask for an itemized list of charges to make sure you understand everything that was included in that bill. And then ask about options. There are times where even if a bill is not quite what we wanted it to be, it may in fact be accurate. There are still options for you. So billing companies often can offer things like financial or hardship assistance. This sometimes includes discounts on bills or reductions in bills. If that's not an option, many billing companies also offer things like payment plans, extensions, deferments. But you do need to reach out and ask and let someone know that you're unlikely to be able or concerned about being able to pay the bill in the time given. And I know that can be a scary thing to do, but in my experience, billing agencies are often willing to work with you and offer options, but you do need to speak up sooner rather than later to let them know what's going on. Additionally, in addition to the other things we've talked about tracking, making sure to set aside time to pay bills and keep track of what has been paid. It's not uncommon to sometimes get a duplicate bill or a bill for something you're quite certain you've already paid. And I know it can be a pain to have to follow up again if there's an error that's on the part of the agency, but it's just really important you're not letting anything go unnoticed or unresolved, just to make sure, again, you're not wasting any more energy or any more money than you need to. With that, I want to talk about some additional resources and some concrete ideas of things that may be helpful to you as you think about both household and treatment-related expenses. Knowing that we have folks here from a variety of places, I did try to focus on general resources that are fairly widely available and applicable to most brain tumors. I'll also be highlighting some resources and places you can go to look for more specific programs for your specific location and your specific type of tumor. So I first want to just highlight a few resources available to you within the medical system. Most every medical facility has some kind of financial counseling program available to help you both figure out insurance-related concerns, but also help navigate medical bills. So, financial counselors can assist with things like if you don't have insurance or are concerned with insurance, they can help explore eligibility for programs like Medicaid or Medicare. They can also help confirm your insurance benefits and give you ideas of estimated out-of-pocket expenses for the type of treatment you're seeking based on your insurance plans. They can also help us navigate setting up payment plans if you're concerned about being able to manage your out-of-pocket costs. And many medical facilities also offer financial assistance programs. Sometimes these are called charity care, but typically you'll either look out for the words charity care or financial assistance. And those are typically needs and income-based programs that can help give you discounts on your out-of-pocket expenses. Similarly, many medical systems have billing departments, as you well know, but they can also, in addition to sending you bills, can also be helpful in not only answering questions about bills, but help you if there are disputes or if you need to refile or try to dispute something with insurance. They can be helpful in advocating with that. They can also help you set up payment plans or explore any other assistance options. Many medical facilities also have insurance coordinators that can assist with reviewing insurance benefits, help confirm coverage. There can certainly be some overlap between insurance coordinators, billing department, financial counselors. But I would say in general, ask your medical team if you are having concerns or questions around navigating insurance and medical bills. Let them know and they can help direct you to the right person in your hospital system. I also wanted to plug insurance member services. Many insurance plans, if you turn the card over to the back, will have a member services line. These are often run by insurance coordinators. Many insurance plans also have social workers or care managers who can help advise on some of the benefits I mentioned earlier. So if they know you're going through a major medical condition, they can help you figure out what additional benefits through your insurance might be helpful to you in saving you money and getting you the care you need. But they can also be really helpful in advocating for you if you are having any challenges with your insurance or with getting things covered. I also want to plug social workers, such as myself. Most medical facilities also have social workers or care managers. Our roles is, as I mentioned earlier, to assist with any of the non-medical needs that come up as you go through your care. That includes, as far as financial support, there are a number of different topics we can help advise on. And I'm going to cover each of these in a little more depth as we go. But we can help advise on disability benefits that might be available to you if you've had to stop working or are anticipating loss of income or extensive time off work due to your tumor. We can also help advise on programs that may be available to you to help manage insurance costs, prescription costs, other out-of-pocket expenses. That includes copay assistance programs, prescription assistance programs, grant programs. I'm going to highlight a few of these in the coming slides to give you some ideas of what's available. We can also help advise on emergency assistance programs available to you to help with things like utilities, rent, mortgage, food, and we can help advise on public benefits like SNAP or Medicaid. The other reason it can be helpful to connect with a social worker in your medical system is that we tend to have pretty good knowledge of how to personalize resources based on your specific situation. So based on where you live, the type of tumor you have, household size, income level, there may be different resources available to you, and we can help save you from some of the work of figuring out what those are and help to identify programs that are likely going to be a good use of your time to pursue. So with that, I want to briefly spend some time talking about each of these different resources. Disability benefits could be its own topic, and there are webinars and programs that will go into much more depth in this that I can plug at the end. So I'm going to do a pretty high-level overview here. But generally, if you've been diagnosed with a brain tumor, it is possible you are going to need to take some significant time off work for treatment. I'd encourage you, if you have not already, to be talking with your medical team about if you are working, what your job is, and have an honest conversation with them about what you might expect from treatment and how feasible it's going to be to continue working, as well as, get some estimates and ideas of how much time you may need off so that you can figure out what your best options might be. But generally, disability benefits are meant to be a way for you to get income if you are unable to work due to a medical condition. There are a few different types. They all have different eligibility requirements. One of the most common ones, if you are working, many employers offer short and long-term disability benefits. These typically allow you to get a percentage of your salary if you need to take time off work. So I'd encourage you to talk to your HR and benefits team to find out if those are available to you. There are also private disability benefits programs. It's typically hard to get these once you've been diagnosed, but if this is something you happen to have already had, these can very much be a resource to you if you do need to take time off. And then some states, if you happen to live in California, Hawaii, New Jersey, New York, Rhode Island, or Puerto Rico, you are lucky enough to have state-sponsored short-term disability programs, and I'd encourage you to look into that. And then one of the common disability benefits programs folks often think of is Social Security. Social Security has a couple different types of disability programs, but generally speaking, they require, their definition of disability is that you have a medical condition that makes you unable to do your job or any job for likely the next 12 months. Or you may have already been impacted and unable to work for up to 12 months. That is generally kind of the criteria they're looking at. You can really be applying for any disability programs available to you, but this is another area where I'd encourage you to be talking more with your medical team and asking for help from a social worker or care manager if you need support figuring out what are the best options for you. A few things that are helpful to find out for any disability benefits program you hear of are what are the eligibility requirements, how does this plan define a disability, and what type of documentation or evidence might be needed to prove this. Again, your doctors can be helpful in advising if it seems likely that this plan feels like a good option based on your condition and situation. Also important to find out how much the benefits pay. Some disability benefits plans are lump sum or fixed monthly amounts. Some are a percentage of your income. And also get a sense of if these, benefits are ongoing or are time limited. And get a sense of when you might expect to start receiving them. Some disability benefits programs take a decent amount of time to get processed, so having an idea of what to expect is going to help you most effectively manage your current savings, as best you can while waiting for these to kick in. Knowing that it can take a minute for disability benefits to start being helpful to you, I do want to make sure you have ideas of other programs that can help manage savings and provide financial relief. So there are a number of great programs that offer copay and prescription assistance. On the left, Health Wealth Foundation, PAN Foundation, Patient Advocate Foundation. These are programs that offer copay assistance and helps with things like insurance premiums and copays. You search by diagnosis, and they will show you if they have open funds available for your specific type of medical condition. Cancer care is similar, but specific to folks with cancerous tumors, but they also offer copay assistance. I should also plug that Cancer Care does also have a grant program to help with transportation for brain cancer patients. And they have a financial navigation service. So you can call them and they will help ask you more questions about your situation and help advise you on programs that are available nationally and in your area to support you. So if you happen not to have access to a social worker or care manager in your medical facility, Cancer Care is a great resource as well. GoodRx is a prescription assistance program. If you are struggling with some medications not being covered, or they're covered, but the copay is extravagantly high, GoodRx offers different discounts and coupons, basically, and including for things that insurance doesn't cover, like over-the-counter medications, vitamins, things that may not be as costly, but it can add up. So knowing that this is available, I'd really encourage you, for any medications you're buying regularly that you are struggling to manage costs of, to look, because there are often some better deals through GoodRx. And then Needy Meds is an organization where they allow you to search by diagnosis. So you could search by brain tumor or brain cancer, and they pull up a number, they kind of consolidate for you what some of the prescription assistance programs and grant programs are, both nationally for that diagnosis and also in your area. So if there are state-specific grants or programs, they tend to pop up on Needy Meds. So another great resource if you need direction and guidance on what's available to you. And then for grant programs, again, a social worker or your medical team can help advise depending on your geographic location and your exact diagnosis, because there are often additional programs available depending on where you live and what condition you're dealing with. But I did want to highlight Glenn Garcelon Foundation. Since they are a nationally available program, they provide needs-based grants up to $1,000 to patients with a primary brain tumor. And they can help with any kind of out-of-pocket expenses, covering things like rent, groceries, or covering treatment-related travel, specialized equipment. You can find the application form online. They do require medical documentation, typically a letter from your doctor or social worker confirming your diagnosis and need for assistance. So this is something you need to engage your medical team with, but do want to make sure you're aware of this program. There are also some great state and local programs available. I, again, am highlighting programs that are available in pretty much every state. And I'll go into each of them in a bit more depth. 211 is the phone program. It's basically a navigation service. You can call in any area and let them know if there's a specific need you're looking for. For instance, if you're looking for rental assistance, if you're looking for food resources, and they can help. Basically, they have access to a local directory and connect you to local agencies that can assist with that. So that is also going to be a good resource if you don't have a social worker or another support to help you figure out local programs. 211 is a great place to start. Some of the programs they can advise on include LIHEAP is the low-income home energy assistance program. They help provide needs-based utility assistance that can include discounts with utility bills, also weatherization to help weatherproof your home to try to minimize your utility expenses. SNAP is food benefits program. These again are available in every state, but each state has kind of their own application process. The Department of Health and Human Services is the organization that oversees programs like SNAP, Medicaid, other cash benefits. So this would be another great program. If you're not sure how to access these in your state, you could call 211 and they would help direct you to local offices or to agencies that can help you apply. Additionally, Meals on Wheels is a meal delivery program that assists folks who are unable to, due to mobility issues or other concerns, have difficulty getting out of the house to get food on their own. And then the Salvation Army is another program that's available. There are multiple locations in each state. And they offer emergency assistance, things like food, clothing. They often can help folks in exploring utility, rental, or mortgage assistance programs. So wanted to plug some of those. Depending on where you live, some cities and townships also have their own assistance programs. Many townships have what's called general or emergency assistance. So I'd also encourage you to look into that. Many townships also have folks who can help apply for programs like LIHEAP and SNAP. I also want to say, any place you're receiving bills from, even if they're bills you've always gotten from utility providers, loan companies, tuition programs, it is worth reaching out and asking about hardship or financial assistance. This does require you speaking up and potentially letting them know or disclosing a bit about what's going on, but I have had many patients have good success with letters of support from social workers, doctors. I've had folks had success getting discounts in college tuition that they've been paying for their kids. I've had folks get free childcare from a local daycare to help them recover from surgery. Many utility assistance programs offer hardship assistance, but it does require you to reach out and ask. These are typically not advertised, since programs certainly don't want, to give out free money or let you know that you can get discounts on bills. But, many places are compassionate and understanding that there are extreme circumstances that make it such that, you may need a break and need some support while you're managing major medical care. With that, as we wrap up here, I do want to just plug a few other places you can go to find additional financial support. Certainly, the American Brain Tumor Association has a page it covers some of the programs I mentioned here, but also a number of other financial assistance programs. And then Triage Cancer has a booth outside around the corner to your left that I do want to plug. They are a great resource for folks navigating any medical condition. Their main website is triagecancer.org, but they also help manage and support myhealthcarefinances.com and cancerfinances.org, both of which are great sites that go into more depth on many of the topics I discussed today. And cancerfinances.org also operates a bit like a question and answer site where you can check some of the concerns you're having, questions you're having around insurance, disability benefits, medical bills, insurance denials, and they will give you kind of guided tutorials and resources to help support. So with that, I know I covered a lot of things at a high level fairly quickly, but I am hoping that some of these programs are new to you or give you additional ideas that will help make it feel a bit more feasible and manageable as you are dealing with the many expenses that are ongoing and that are new as you go through treatment. So thank you for your time, and I'd be happy to take any questions if folks have them.
Thanks. I was just wondering if you could put the last slide back up.
Oh, of course, of course.
Yeah, thank you.
Yeah.
You mentioned, well, I'm not sure actually if you mentioned this, but in terms of when something is billed incorrectly, what is the best way to address that or manage that?
Yeah, so I would say,
sorry, just to provide context, does everyone know what I'm talking about?
What's that?
I was like, to provide context, what I'm referring to is we had services that were considered covered at 100% under medical, but then they billed it as behavioral, and it was for rehabilitation, and we had no rehab benefits. So then we got billed at 100%. So it was a constant battle, and we eventually got sent to collections, and I answered the call every Friday and said it was billed wrong, and somehow they've just stopped calling me. But that's really stressful for families, and so I just wasn't sure if you had advice on how to manage that.
Yeah, that's extremely stressful, especially if you're quite confident if you did nothing wrong, and something just sometimes with medical bills, they can feel like they're happening to you. First of all, you did the right thing by first just trying to speak up and clarify what happened. I would advise sometimes it requires you to talk to both your insurance company, to the place you received the medical care from, and sometimes also talking to your doctors or the person who provided the service to see if they can help advocate. Often they are able, especially if they understand the issue or understand that by coding it one way, it will be covered and another way it won't. Often your medical providers will be willing to work with you to figure out how to get things covered. So it does sound like you worked hard in this case to do your best with it, but sometimes involving as many people as possible to help advocate can be helpful, because often the change needs to start from the medical system and they may need to file a new claim or revised claim with the insurance company. Yeah. Yeah, of course. Absolutely. I'll also add there are, I know I mentioned earlier places like the State Department of Insurance. Certainly Triage Cancer also has some tips and guides on like legal issues. There may be a time where, you need to get other folks involved or laws involved on your side to help you. You do also have the right, especially if something's in dispute, to ask for a bill to put something on hold. Often they will give you, billing agencies will give you a certain amount of time. I just did this with a patient. We got 45 days while we're trying to dispute something with insurance, where he basically isn't responsible and, the bill's kind of on hold being waived while we're trying to sort out and figure out if we can get it overturned. So you do have the right to ask for that.
So adverse to the microphone. The other thing that I wanted to add is in terms of when bills come through and you're not necessarily, it looks like an exorbitant. Is there feedback or is it just me? Is it me?
Yeah.
Okay, is that better?
That sounds better.
Okay. It was just going to be around the fact that if you get a bill that comes in, don't just assume because it comes through the hospital or through a certain provider that your insurance is on file. So there's been a lot of times that I'll get a really large bill and then I'm like, they were like, well, you don't have insurance. And I was like, but I do, and it's on file. They're like, not with us. And so then they have to rerun it and put your insurance on file. So don't just automatically pay the bills when they come in. If something looks a little funky, just call and get it questioned. And for us, like at least half of the time, insurance wasn't on file with that particular doctor or provider.
Yeah. That's a great point. Yeah, and as much as you can try not to panic when you get a massive bill you weren't expecting, and I know it's not a small thing to have to take time to call to figure out what's going on, but it is true. Yeah, often places like pharmacies, sometimes labs that like blood work is ordered through end up existing outside of your medical system, and they may or may not have your insurance info on file. So that's a great tip. Yes, so I wouldn't pay anything yet. I would definitely make a call to find out a bit more about what's going on. Yeah, so I would likely, there may be cases, I don't want you to be endlessly on hold with providers. There may be cases you may want to call both, or you divide up. Maybe I'll call the billing agency, your friend can help you, or you can keep, sometimes I encourage folks to pick a day where you are. It could be just a day you're sitting in infusion treatment anyway. Keep the phone on speakerphone on hold. So if it's a day where it's not a big deal for you to wait around for a bit or you're going to be sitting anyway, so it makes it a little less frustrating. But I would start with the billing agency probably, just to clarify and say that based on what you understood from your insurance. And it could be a case like what was mentioned in the back, where they could say, oh, we didn't have your insurance on file, or you don't have insurance. And it may just be a matter of they need to rebill, or file a claim, and then you will typically in those cases get a corrected bill later. But if they don't know what's going on either, then you may want to call insurance to advocate further. That would be my sense. Other questions? Yeah.
Hi. I handle all the billing on behalf of my brother, who's the patient. And I've noticed as I'm navigating through all this, a lot of times when I call, I'm most of the time required to provide his authorization to disclose medical for privacy reasons, HIPAA. Is there is there like an overall something I can do in advance that gets his authorization for me on his behalf, instead of having every time if I'm having to call a different provider or arm of an insurance company, so that it can just be easier for me as his advocate in handling that, so that it's not like individual forms for each leg or each person service?
That's a great question. It depends a little bit on the agency. Some like programs or insurance companies or medical facilities will accept if you do have a healthcare power of attorney on file. Now, power of attorney forms, they don't necessarily mean that you automatically have the right to start taking over someone's care, but patients do have the right to check or add on if they want this to go into effect right away, or if they do want to give this person consent to be able to speak or make medical decisions on their behalf. So some places will honor that. Like if you're newly engaged with a medical facility and you show that form, they may be able to start right away without having you have to sign a number of additional forms or get additional consent from the patient. Sometimes insurance companies will require the person to be on the call or the first time around to help set up a friend or family member as a permanent alternate contact. But sometimes having a power of attorney, or if there are cases where there's already been any changes in guardianship or anything like that, if you have forms to support that, most places will honor that. Yeah. It can help, yeah. Yes. It can be helpful to have both, depending on your family situation. Oh, yeah. So on the phone, that is where for insurance, sometimes they are sticklers about at least the first time. You can definitely get added permanently as an authorized contact, but they may require the person to be nearby just to provide verbal consent the first time. But you can also call and let them know, I have this form, can we email or send you a copy so you can add it to the file, because that may also be helpful.
I'm single and my daughters couldn't call in on my behalf. They needed to know my social security number, which was available to one of them, but not the other. And so I think it's important to, in your case, your brother, but to have people added as a contact. And so when my diagnosis happened, like all of my kids, both my daughters, were on all of it. Phone, cable, gas, all of that. That was like one of the first things. I also put them on my bank accounts because I didn't want it to look illegal that they were transferring money for me or signing a check. But I also have power of attorney, medical and financial. But it's after the fact. Right. Do you think you can get it?
I mean, I have healthcare power of attorney
Okay, good.
for my brother. And I remember in the attorney's office, I remember that what you mentioned about, like, is it, his check mark was, I think, for when he's unable to make his own decisions. So, you know, that, then I get, we need to have that amended. But, you know, I just found that there's like, this agency, this company, like, there's just so many layers involved, and it would be easier because sometimes, sometimes you're just on the phone, and then they're like, we can't talk to you about this until we have his written documentation, which, like, I can take care of quickly, but I just wondered if there was just something in advance that I could have that, but, yeah.
Not always, unfortunately. But I think relatedly, working with your loved ones, if you are, you know, a caregiver, or if you're, you know, want to empower your caregivers to help, also being thoughtful about like whose contact info is on file. There may be cases for certain bills. You may want certain things sent to, you know, the person who's helping you manage it. If you have a loved one navigating a tumor and they're in a place either where they're too overwhelmed to deal with bills, or just may not be in a good place to be handling and managing them, talking with them about updating contact info, see if, you know, it's appropriate for you to be the primary person that doctors call to coordinate appointments, or the primary address for bills to get sent, so you can help make sure everything's getting followed up on appropriately. Those can also be helpful, and just making sure nothing gets missed.